This medicine ECG review will focus on case number 478 from ECG Wave-Maven. Copyright information is provided here. This ECG is from a middle-aged man. What does the ECG show? The answer: left bundle branch block. The ECG shows a sinus rhythm with a physiologic PR and QT interval. The mean QRS from the frontal plane axis is within normal range, and the QRS duration is prolonged 140 milliseconds, normally less than 110 milliseconds. With the classic left bundle branch block morphology, the ST-T abnormalities we see discordance of the QRS and ST vectors are consistent with secondary changes due to the abnormal sequence of ventricular depolarization. Left bundle branch block indicating degenerative change or damage to the left side of the His-Purkinje system is often a marker of left ventricular hypertrophy, LVH, which was not found by echocardiogram in this case. The concomitant ECG evidence of left atrial abnormality makes LVH even more likely. No perfusion abnormalities were noted on nuclear imaging or pharmacologic studies in this case. No evidence of acute MI was noted with similar ECGs. Left bundle branch block may mimic ischemia myocardial infarction because of its association with J-point ST elevation in the leads with a negative QRS area, and of ST depression and T-wave inversion in leads with a positive QRS area. A left bundle branch block pattern may also mask the diagnosis of acute ischemia. Therefore, considerable interest attends the uses and limitations of the ECG in the diagnosis of ischemia superimposed on a left bundle branch block, making this aspect of ECG diagnosis an active area of investigation. Left bundle branch block is clinically important as 1. A marker of underlying structural heart disease, especially from systemic hypertension, left-sided valve disease, cardiomyopathy, or from advanced coronary disease, typically with LV dysfunction. 2. A cause of worsening LV function in established cardiomyopathy of various causes. 3. A potential cause by itself of decreased LV function. And 4. A marker of infranodal conduction impairment. However, chronic left bundle branch block per se is not an indication for permanent pacing. The prognosis of left bundle branch block depends on the clinical context, best for those without underlying heart disease and worst for those with advanced heart failure.